I'm here today with Kristi Crowe from AHI to talk to you a little bit about the important decisions that orthopedic practices and orthopedic service lines need to consider when they think about growth in the future. Hi, Kristi. How are you?
I'm good, Amy Brouhle. How are you?
I'm great.
Wonderful.
Well, let's go ahead and jump in. I know we've got a lot to cover today. So, Kristi, give us a sense of your philosophy when you founded AHI about 5 years ago.
Yeah, really, it was that there is a huge gap between having a strategic plan and actually getting results. And so we really aim to close that gap, Amy, as you know very, very well, participating in these initiatives every day. So we use a data-driven approach. We certainly look at market data and those kinds of things, but also have really made an objective assessment of what is needed to move market share to your practices, which will be critical, as we discussed today, in knowing how many physicians that you might need and in what subspecialties. So we are very data-driven and also quick. Having these tools that, allow us to make decisions quickly and evaluate the opportunities quickly gets really results much quicker than our clients can get alone.
Fantastic. Well, let's go over the agenda of some of the areas we're going to cover today, Kristi. We're going to talk a little bit about the challenges that current orthopedic groups face in their markets, the cost of guesswork or going with your gut, why data is so important, and the data that you've specifically curated to drive some of the decisions you've done with the work that you've done across AHI with your clients, more about how we can help in the areas that are important, a little bit about our platform, and then most importantly, key takeaways and next steps.
Yes, yes. Very excited to talk about those things. And what we hope to convey here is we take a very pragmatic approach, right? Very real world. And when you said the guesswork, right? What's the cost of guesswork? It's our guts can tell us a lot, but it sure helps to have some validation and to really refine and prioritize what you need to work on by having some data in your pocket. All right, so let's talk about this. Here's the situation that we see very, very commonly when we're working, particularly on the orthopedic practice side, is that there's fear in recruitment. What if we can't make that physician busy? What if by hiring another physician in that specialty, the physician that already has that specialty or those physicians will then see a decrease in their volume, right? We have to be very careful about this. But frankly, the market landscape is just getting to the point where you don't really have a choice. You sort of have to grow. There's a lot of competition in the market. Certainly, a lot more hospitals are employing physicians, not just specialists like orthopedic surgeons, but also primary care physicians, and sort of controlling those referral paths. So making sure that you're recognizing where those opportunities and gaps and perhaps levers might be for your own partnerships to be able to realize that growth. So one of the things that we can certainly talk more generally about recruitment, but one of the things that I wanted to make sure we get in today, so I'll just jump right in it, is really what type of subspecialists as well. We recently worked with a medium-sized physician practice that we looked at what their market needed, their service area where they have their clinics. And we looked at the balance of subspecialists that were needed by that orthopedic practice. And lo and behold, their practice was not very representative of what the patients needed, right? They had too many hand and upper extremity surgeons, too many foot and ankle surgeons, and not enough joint and spine surgeons. So really, they transitioned their recruitment plan a bit. They sort of let some of their pending retirements for the specialties that they no longer needed excess volume in. They didn't replace those physicians and instead focused on recruiting those specialists that were in much better alignment with what the market needed, which in turn caused them to get busier much faster.
A great story.
Yes, I love that story.
Well, we know that the cost of guesswork is expensive, right? And we think about the work that you do across your organizations and the way that you leverage data to drive some of those decisions or present those decisions to the practices or to the service lines. Can you talk a little bit about some of that guesswork and some of the areas that you see and how data is changing maybe some of those outcomes?
Oh, yes. So, I mean, one of the most unfortunate things that we see really is, and very consistently, is where there is an undersupply of surgeons in a particular market, we see much more outmigration. Patients will get the care they need. They just won't get it from you. You know, they will leave and go to another practice. So it's important to look at this for your individual practice, but also understand, you know, the competitors in the market. And if competitors are effectively meeting that need, then clearly it's going to be a little bit harder to grow. You will have to plan on stealing some market share, which is why it's important to understand what your market share is. And if you don't get those patients, what competitors are getting them? Do you have better programs than they do? We have some pretty objective tools to measure that, to predict what you might be able to get in terms of market share. So it's really about just, you know, generally how many surgeons you need, what subspecialties, but also then where to place those surgeons, right? So if we're looking across a market and you're thinking, gosh, I think I'll put a satellite clinic over here or a satellite clinic over there, what's really the best location? When you have a new surgeon coming in, you might say, oh, we've got space for that surgeon up north in the northern part of our market in that clinic. Well, is that really the most appropriate spot for that spine surgeon when really most of the patients are sports medicine patients, right? So really understanding where to put those physicians that you're recruiting, where to expand clinics. And then of course, there's also this sort of stagnation that can occur within practices. We probably see more often where there's so many different opinions among individual stakeholders and shareholders, right? Well, I don't want to hire a physician, or I'd love to hire a new physician, right? Let's get that person on the partnership track and have that new surgeon help share overhead expenses, but let's not hire him in my specialty. Let's hire him in someone else's specialty because I don't want to lose any volume. So really there can be kind of a lack of alignment, and really using more data-driven approaches can really help very quickly build consensus among the group.
So that was really helpful. And those are really important areas for groups to consider as they're thinking about um, where they go next, how they maintain their income, those kinds of things. Can you talk a little bit or maybe tell some stories about how AHI has helped your customers when you think about things like market intelligence? We've touched on recruitment, but also income preservation, which is probably top of mind for a lot of the surgeons out there today.
It's top of mind for me. It's top of mind for you. No, so yes, I think one of the big things that we oftentimes will look at, and certainly we've talked about market share as well too, but it's about leakage from your practice or your program. You know, when we work with hospital clients, we'll see that, you know, perhaps, you know, the primary care physicians that they've employed maybe aren't as loyal as they thought they were, and they're referring patients to practices that are not affiliated with the hospital. And I think folks are fairly used to seeing that type of data, and you know, we anticipate some leakage always occurring. Clearly, patients have a choice, that kind of thing. But where it gets really tricky is when we're looking at this on the physician practice side, where literally this is only a physician practice that specializes in orthopedics. There are patients that are coming in and seeing your providers, your nurse practitioners, or your surgeons, and then have their surgery somewhere else. It is critical to get to the bottom of why that's happening. We have seen it be a result of payer contracting, right, and narrow networks, those kinds of things. We've seen it be a result of not being able to get a follow-up visit quickly enough. So there's access issues, there's payer issues, but really getting to the bottom of what might be driving that is a critical component of what we do. And then, of course, certainly ensuring that as you're recruiting, also that you're recruiting not just the right specialist, but the right care philosophy. So, we recently worked with a program in which, very small program, had one joint replacement surgeon, and that surgeon did not do anterior hips. And again, this was a pretty rural market. The patients were leaving to an even more rural market in order to get their hip replacements done with this other provider. So this is not just a story of, oh, yes, of course, we're going to lose some patients to the big city. No, we're losing from rural to super rural, when you don't have the things you need. So that practice is they add another physician really needs to make sure that the care philosophy is aligned with what the patients are asking for in those markets. And then, of course, that last piece of what we're all trying to do, right? Income preservation. Boy, things are getting more expensive. I don't know that I've spoken to a single practice that hasn't had, double-digit growth in labor costs over the last couple of years. That's the wrong kind of growth. Construction is super expensive. It's just going to eat at your revenue. So you're not going to have anything left in terms of margin, right? To pay physicians. And so really to preserve income, you've got to grow. There's not a choice. I get it. Some practices may say, no, we feel pretty good at 12 surgeons. We don't really want to become 15. Well, that's okay if you're willing to let your income go down. But really you've got to grow to be able to preserve that margin that's gonna drive the salaries of the folks that are working there. So not much of a great choice probably, but certainly there's always capabilities to enhance that revenue.
And why smart growth is so important.
Yes, absolutely.
Speaking of that, right? Speaking of smart growth, you've spent a lot of time evaluating data, and there are lots and lots and lots of data sources in the market today. But talk a little bit about your perspective on the data and why the data and the platform that you've developed has been able to drive so much innovation and growth for the organizations you work with.
Yeah, and really, I think it's a combination of a few things. I mean, the first step is not just relying on the market data, not just defining data as market data, right? It's about bringing in the right elements. It could be survey data about patient preferences and how those vary in different zip codes across your market. It could be, yes, some of the claims data that tells you your market share of surgeries in your market, those kinds of things. Could be things like our assessment tools that we use to determine the maturity and what we're calling the strategic vitality of your program, a very objective way to do this. But even as we look at things as simple as market share, right? There is a lot of noise in the data out there. And you've got to know how to sort of slice and dice it to get to the right subspecialties, to get to just surgeons as opposed to having a bunch of noise and nurse practitioners and care models that are vary across practices. You don't want those kinds of things giving you the wrong data insights. So there's in every report that we do, every query that we have on our platform, there are multiple layers of analytics behind it before you ever see that visual result. We sort of do that thinking for you so that you don't have to ensure that those insights are correct and the right ones that will deliver the best outcome. The other thing that frankly I was surprised to hear how strongly this was valued from our clients when we first rolled out the platform is it's not just about the specific types of insights that each insight in and of itself that we put on the platform, but rather the combination of them. So what we've heard is that this tool can really help to almost teach these folks that rarely have a chief strategy officer as part of the practice, those kinds of things, can teach them what they need to be looking at and sort of gets them thinking differently about their markets and their growth and recruitment plans.
That's fantastic. So if you had to summarize some of the key takeaways and how you've seen the data, the insights, the experience that you bring to the table really drive from a results perspective, how would you characterize those wins?
Yeah, I think I would say probably the biggest, right, is aligning leadership. And again, it's very easy to have different stakeholders from different areas of the program or from individual physicians. It's really hard to look outside of your own lane, right? So getting that alignment across the shareholders to make a decision, right? One of the biggest risks here is doing nothing. Until it's too late and your competitors have done something like, perhaps signed with another group or formed a super group that you're not part of, or those kinds of things. We see that happen all the time. So don't wait, keep on top of these things and understand your opportunities early and get aligned so you can get a decision and move. So I mean, I think that's a big one. I think the precision elements are another one. We talked about that a little bit earlier, making sure that you're hiring the right subspecialties for the market and that you're putting those folks in the right places. So just another level of precision that, again, it's going to get you results from that recruitment effort much, much more quickly than you would get should you not have those insights. And frankly, just being able to, for lack of a better word, just steal patients from your competition. It's important to understand what that means. So who are we going to steal from? How many patients are we going to steal? What does that mean for our market share? Because this is what we see happen all the time as well, is practices or programs will look at their volume and they'll say, wow, we're growing. This is great. We did more surgeries this year than we did last year. That's all well and good, but your market grew actually at twice that rate. So your relevance, your market share in your market actually diminished. So that's a bad sign. Like we've got to do something to get that, top market position back for you and ensure that you at least, maintain your market share, if not steal from some others. So really a multivariant approach, right, to ensuring that these practices have success.
Absolutely. Well, we've covered a lot of ground today. We appreciate everybody's time and attention, and we'd love to hear from you. So if you get a chance, please reach out. You can see the QR code here. We'd love to help you with your recruitment and growth initiatives. We look to hear from you soon. Thanks for your time today.
Thanks, Amy.